adenocard, and she is adenocard too. And
We
are
adenosine. Our chemical name So for our drug classification, we have therapeutic and pharmacologic classification. For the therapeutic classification, we are antiarrhythmic agent, and for the pharmacologic classification, we are nucleosides.
we are under the pregnancy category of C.
Now for the mechanism of action. We stimulate AGON receptors to slow conduction time through the AV node and alpha-2 receptors to produce peripheral and coronary vasodilation, thus increasing blood flow in normal arteries with little to no increase to stenotic arteries. Now for pharmacokinetics, first is the absorption. We are rapidly absorbed by erythrocytes and vascular endothelial cells after fourth administration. And for the distribution, we are rapidly taken up by an active transport system into erythrocytes and vascular endothelial cells. And for the metabolism, we are metabolized in the blood and tissue, deaminated to inosine and subsequently to hypoxanthine. We also undergo phosphorylation to adenosine monophosphate within blood cells. And lastly, for the excretion, through plasma elimination. And for the onset, we take about 20 to 30 seconds. And for the indications, we are used as an initial treatment for the termination of paroxysmal supraventricular tachycardia or PSVT, including that associated with accessory bypass tracts. And we are also indicated for terminating stable neurocomplex supraventricular tachycardias or SVT. We are also indicated as an adjunct to thallium-201 myocardial perfusion scintigraphy in patients unable to exercise adequately. This is for stress testing or diagnostic testing. Now for the contraindications. We are contraindicated for people with hypersensitivity, second or third degree atrioventricular block, sinus node disease such as sick sinus syndrome or symptomatic bradycardia. We are contraindicated for individuals with clinical active bronchospasm, either secondary to reactive airway disease, chronic obstructive pulmonary disease or COPD, or asthma.
Extreme caution requires emphasis in administration of adenosine in any SVT patient involving accessory pathway, including Wolff-Parkinson-White syndrome. In general, clinicians should not use adenosine with irregular or polymorphic wide complex tachycardias, a Class 3 recommendation, because administration can cause degeneration into ventricular fibrillation. Even in the setting of known antidromic AVRT, because of its underlying atrial fibrillation, blocking AV nodal tissue that can cause unhindered conduction in atria to ventricle through this. Though adenosine can slow down conduction of AV node, it does not mean that it affects the accessory pathways. We do have adverse effects in different body systems, like in CNS, apprehension, burning sensation, dizziness, headache, heaviness in arm, lightheadedness, numbness, and tingling in arms. In cardiovascular, chest pain, facial flushing, hypotension, and palpitations. And ENT, blurred vision and throat tightness. Then in GI is metallic taste and nausea.
For genitourinary tract, we have groin pressure. For musculoskeletal, we have back pain and neck pain. For respiratory, we have chest pressure, dyspnea, shortness of breath, and hyperventilation. For the skin, we have diaphoresis. For the urinary system, We reduce blood flow, glomerular filtration rate, and decreases secretion of renin.
Dear future nurses, before administering us, you are responsible to conduct the mentioned contraindications to prevent a potential adverse effects and conduct also thorough physical assessment to have a baseline status and determine the effectivity of the drug and also to prevent potential adverse effects. You are also responsible to assess neurological status of the client to identify known CNS drug effects, and also you are responsible to monitor closely the cardiac status to identify whether the change of drug dose is imperative. During administration, titrate the dose into smallest amount enough to manage arrhythmias and to decrease risk of that drug toxicity. You need also to monitor the cardiac rhythm. Provide comfort and safety to help patient tolerate drug toxicity and also ensure maintenance of emergency drugs and equipment at the bedside to promote prompt treatment in cases of serious toxicity. After administration, you are responsible to monitor patient response in therapy through assessment and cardiac output rhythm. Also monitor any adverse effects. Then, evaluate patient understanding to the drug by asking the patient to name the drug, its indication, and the adverse effect to watch for. Also, monitor the patient compliance to drug therapy.